Well, as we plod through the final months of flu season, Colorado lawmakers are working to provide some clarity to the shifting federal vaccine guidance. Glad you're with us tonight. I'm Shannon Ogden. Now, Governor Polis just signed a law that allows the state health board now to consider vaccine recommendations in addition to those of the federal government. It also expands vaccine access in our state. Well, tonight, Denver 7's Maggie Bryan speaks with vaccine advocates and with a lawmaker who says this new law puts a target on Colorado's back.
Protecting access to vaccines.
Things have been so chaotic, they can change at any minute.
That's the goal of a new state law signed by Governor Polis on Friday. It allows the State Board of Health to consider vaccine guidance beyond CDC recommendations from medical associations, including the American Academy of Pediatrics.
Their recommendations have been very stable.
Vaccine advocate groups like Immunize Colorado find comfort in the new law. In January, the CDC changed its childhood vaccine recommendations, dropping COVID, flu, rotavirus, Hep A, Hep B, and meningococcal vaccines. Those 6 vaccines are now only advised for high-risk groups or after consulting with a provider.
It just really confuses people as to what people should be doing and what they need to protect themselves and their kids.
When the CDC changed the childhood vaccine schedule, we spoke with Dr. Bob Belknap with Denver Health.
People are coming in with more questions. I think that those questions oftentimes are related to how people get information. So it probably has more to do with what folks see on social media.
The new Colorado law also codifies pharmacists' authority to continue prescribing and administering vaccines and allows the state to fund vaccines for children if federal funding were to be pulled.
We are very concerned that, somehow that program may be defunded.
I think that we are risking our funding in a budget year when we cannot do that.
State Rep. Brandy Bradley, a Republican who represents Douglas County, voted against this bill. She says publicly bucking federal guidance is a bad idea as the state faces a budget crisis for the 2nd year in a row.
I think the Trump administration is really honing in on the state of Colorado, and I think they're looking for an excuse to pull funding.
Bradley also agrees with the new federal guidelines.
I think that we don't need a lot of the vaccinations. I also have a problem with pharmacists giving vaccinations to children. There's no medical record involved.
In Denver, I'm Maggie Bryan, Denver 7.
And going in depth, Governor Polis's public stance on Health Secretary Kennedy has been fluid. Now, Colorado now is part of the governor's Public Health Alliance, which was formed in October, aimed at coordinating public health efforts, and it rebukes most Trump administration health policies. Governor Polis has said the goal of this is to protect the health of Americans. Now, Polis offered initial support of RFK's nomination to health secretary, writing on X back in 2024. He helped us defeat vaccine mandates in Colorado in 2019 and will help make America healthy again by shaking up HHS and FDA. Now, Polis went on to say, I hope he leans into personal choice on vaccines rather than bans. Now, the governor then posted another statement to clarify that position. He said, science must remain the cornerstone of our nation's health policy, and the science-backed decisions to get vaccinated improves public health and safety.